everybody, and welcome to this edition of Cogeco North Bay News, truly local television. I'm Greg Estabrooks. Well, indeed, provincial NDP leader Andrea Horwath was in the riding on the weekend to get input on the local healthcare situation. Evidently, Horwath didn't like what she heard as she blasted the Liberal government for neglecting healthcare, especially mental health care in North Bay.
Patients or people with mental health issues who are ending up in the criminal justice system, who are ending up in corrections facilities, and not being provided any care whatsoever there for their mental health problems, not being provided with any service whatsoever, and that's because they don't belong in a corrections facility. They belong in a community that provides mental health services. But the Liberals talk a good game around mental health. They claim that this is one of their priorities, and yet in a community like this one and many others, unfortunately, I hear the same kind of tragic stories that people cannot get the kind of help and support that they need in terms of mental health. I've also heard horror stories of patients who are leaving hospital quicker and are going back home sicker. Any person will tell you that their health and the health of their loved ones is the priority. What we're seeing, though, is a government that is not putting health care at the top of the priority list for Ontarians, and so. Just as we leave today's meeting, next week we're back in the legislature for one last week before the legislature rises, and myself and France Jelena, my critic for health, are going to be back in the legislature hammering the Liberals and telling them that this nonsense has to stop. We are in a crisis right now, and it has to stop. I wish I could say that these stories that I heard today are unique. I mean, they are unique insofar as the fact that you have a unique community. You have certain exacerbating issues like lack of access to general practitioners, like to GPs, right? To regular family docs, if you will. And so that creates more pressure on the hospitals and more pressure in the system. Absolutely, not all communities are in that situation where they have such a shortage of general practitioners or shortage of specialists as well. It seems to me that this is one of the underlying themes throughout the discussion was the mental health crisis and the lack of proper supports and resources to address it in a way that has positive outcomes for patients.